Welcome to Advancing Health. Today we bring you the final segment in a podcast series featuring 4 leaders from San Diego-based Scripps Health who discuss the need for business and clinical contingency plans to sustain patient care in the wake of suddenly losing all technology, as happened to Scripps Health after a dangerous cyber attack nearly 4 years ago. Your host is John Rigi, AHA's National Advisor for Cybersecurity and Risk, and his 4 Scripps Health guests are Chris Van Gorder, President and CEO, Todd Walbridge, Senior Director of Corporate Information Systems, Shane Thielman, Chief Information Officer, and Gerry Soderstrom, Chief Audit, Compliance, and Risk Officer. Let's join them.
Chris, maybe I could start with you. What concerns you most about this continued evolution of ransomware and that we're seeing in the increased frequency and severity of attacks?
I think there's a couple of things. One is communication. Basically, the answer is don't. That was very difficult. As a matter of fact, I was just meeting with a reporter, before we did this podcast, and he was a reporter that was pretty angry at me during the course of our cyber attack and after, because I'm a pretty transparent individual. Our organization is as a major community resource, and it was pretty frustrating for me to be told by every lawyer, our internal lawyers, the external lawyers, the insurance company lawyers, that because of subsequent issues down the road, mostly the class action lawsuits that are sure to follow, that everything and anything we said would clearly be used against us. And I wasn't even able to communicate that to reporters until this morning. And he certainly understood the issue because there's been a lot more cyber attacks, of course, since ours took place. So we had to, mentioned earlier, hire a communications company that assisted us with crisis communication. I remember one day I insisted on making a statement. And it took, I think, about 25 people in 2 different organizations an entire day to write one paragraph that I was permitted to share. And the reason, again, for that is because the concern about regulatory agencies ultimately using that against us, certainly the class action lawyers. And I think that's a real problem because there have been a number of attacks since, and we're willing to reach out and offer our assistance, but there's a concern there that, even though we were doing everything under attorney-client privilege, every contract we made, everything went through our legal office. Once we start communicating to another organization that's going through this, they may in fact not be protected from the information that we share. And so I'm unable to even share our experience with our colleagues that are facing cyber attack for fear of class action lawsuits. So I think in the end, the government really does have to take a look at, setting standards, in my opinion, just as we have standards in hospitals for virtually everything we do. The Joint Commission and our state health departments and CMS survey us to make sure that we are in fact compliant. And if an organization is compliant, in my opinion, they should be held free from future regulatory and class action lawsuits. And in so doing, we can actually share the information more freely and communicate and help each other during these attacks instead of being silent and not being able to do so. I was advised initially not to talk to the FBI, not to release all the data that we had that could have been helpful in the investigation. And I chose, because my law enforcement background and because of my relationship with the FBI, which started long before the cyber attack, that we had an obligation to the country, to the healthcare industry, and to our own organization and community to share as much information as we possibly could. And that's what I insisted on doing, despite legal recommendations otherwise.
Thanks for that perspective, Chris. Again, you understood because of your dedication of your life to service and law enforcement and healthcare, how important it was, not only for you as an organization to cooperate with the federal government, but to help prevent other attacks, as you said, to help warn the nation. Folks, I'll just point to Public Law 116-321, which the AHA helped get passed in January 2021, that does provide a measure of regulatory relief if you can, as Chris said, demonstrate adherences to basic cybersecurity protocols. But the missing element, as you said, Chris, is there's no civil litigation protection there, especially when it comes to the impact of the attacks. Todd, maybe I could go back to you based on your investigative background and wrap this question up. Where do you see ransomware going, especially where we have this kind of hybrid threat, nation state involvement, this murky world? Where does criminality end and really intelligence operations or terrorism begin?
The benefits that Scripps provided to the United States intelligence community were immense. I don't think the intelligence community realized the damages that can be caused to a community through a ransomware attack when you hit a hospital. And we were able to, at a high level, let the United States intelligence community realize the impact of an attack on our hospital system. And as Chris opined previously, that people can die as a result of systems being offline. So I think the United States government needs a combined approach, and that was one of the things that we were able to do with Conti, where it's not just the FBI, it's the FBI and the intelligence community, whether that's the CIA, the NSA, and even working with Cybercom for offensive capabilities. Defending is going to be a cat and mouse game. We've seen some of these groups go after other industries, get out of the healthcare industry, only to find some of these other industries tightening their security defenses and returning back to the healthcare industry, because healthcare equipment that touches the internet is really hard to defend against when you have a vast array of devices that touch the internet, from imaging machines to IV drip machines to just computers. Your average business has servers and desktop computers and laptops that they have to secure. It's different from securing medical devices that touch the internet. So this sort of attack on a hospital system is always going to be beneficial to a ransomware actor unless we start to take away their incentives, or unless we're able to impose some sort of consequence on them. And some of those consequences require the US government to punch a little bit further than the FBI can.
Yeah, understood, Todd. Again, my role, from years at the Bureau of Counterterrorism, we've got to increase risk and consequences for the bad guys and use all the US government's capabilities, both military and intelligence capabilities, to degrade the bad guys' capability to attack us, utilizing those offensive cyber operations. Chris and Shane, to that point, that I, on behalf of the AHA, all of us here at AHA, have been very vocal in the media and with Congress, and with policymakers, that these attacks against hospitals not only threaten the hospital as an organization, they threaten the patients within the walls of the hospital, and they threaten the safety of the entire community that depends on the availability of that hospital. And ultimately, these are truly threat to life crimes. Chris, maybe I'll go back to you. I think you touched on this a little bit. Could you elaborate a little further on how ransomware attacks affect patient care?
Well, we've been calling them cyber attacks and ransomware attacks. These are terrorist attacks, and they have the potential of killing just as much as a bullet or a bomb could. And it's not just the patients that are in the hospital. Remember, when you go on diversion, you're bypassing people who need emergency care, and they have to go elsewhere in the community for that, which costs time, and time could be lives. So these are very significant threats to our country, our communities, and our patients. And I know there's an expectation that somehow hospitals just make themselves safe. But I think, as you've heard through the expertise of the people on my team and Todd's internal and external expertise, is that there's no 100% way to protect yourself 100% of the time. And so the key now is for our country to step up and help support its medical and healthcare industry with expertise and resources, if necessary, if this is important to them as much as it is to all of us. And frankly, to go after our adversaries who are, in fact, international terrorists. We have done that before in response to 9/11 and elsewhere. This is no different. Every single one of these attacks across the country, every time my heart breaks when I see another hospital victim of a cyber incident, most of those are a ransomware attack with flat out criminals and terrorists that are taking advantage of the healthcare system. And we need, I think, to do a better job, and certainly for regulators and legislators to be far more understanding about hospitals as a victim and not the bad guy when there's an attack.
Totally agree, Chris. We are not going to win this battle, this war, on defense alone. There's got to be an equally aggressive offensive side to this as well. Shane, what are your thoughts on that? How did this ransomware attack impact patient care from your perspective?
Yeah, Chris has touched on a few of significant observable impacts to our community. I actually sort of see this as an exercise each time that a cyber attack is announced on a hospital or a healthcare system, as really an exercise in resilience of our clinical community and those that are providing patient care. The mission doesn't change. The tools and the access to data and information are vital to delivering high quality and safe care. But what ends up happening in the absence of access to information that's expected or anticipated when someone shows up for their shift is an incredible amount of ingenuity and a focus on each and every patient and ensuring that the care is of equal quality and is delivered in a safe and effective way. I think as much as we talk about the impact of patient care, we have to consider the clinical community and the impact on the community as well. And so we really have heroes. They're heroes when we're not dealing with cyber attacks, but they are elevated even more in the midst of addressing a significant outage that's caused by a cyber event. And so I really think that as much as we talk about patient care, I don't think that our clinicians get up when they are dealing with a cyber attack and think differently about the mission that they are serving on behalf of the organization. And I think in many ways, we need to be thinking about how do we create the safeguards for them to practice and deliver care in the best way that they can under duress and under challenging circumstances, and then ensure that after the fact that we have mechanisms in place to continue to care for our care providers in a way that allows them to work through that very stressful event and the effects of that stress on them individually, so that once we're back to restoration of all of our systems and to a degree back to normal, that we don't forget about the effect that that's also had on our clinical community.
That's a great point. Clinical staff, as you said, our frontline healthcare heroes have so much to deal with. And then to try to continue providing care without technology is just immense, especially during COVID. Along those lines, we've talked about the attack, the impacts. Let's talk a little bit about resiliency and recovery now. And then, Chris, I'll go back to you and then over to Gerry. So, in the face of this attack, how was your organization prepared to continue to deliver care without technology for an extended period? When I do many, many presentations across the country, I talk about the need to prepare not just business continuity, but clinical continuity plans to sustain a loss of technology during ransomware attacks for up to 30 days or longer. So, Chris, maybe I could start with you on this.
Yeah, again, we relied on our frontline people to identify whether or not we could continue taking care of patients. And if not, we would transfer those patients. In the case of radiation oncology, patients that needed to have therapy every single day, we were not certain that we could do that. And so a number of those patients ultimately were referred to outside radiation oncology centers so that they could continue their therapy. There were other practices that we were able to continue. There were some x-rays and other devices that continued to be used, but not necessarily connected to the electronic health record or to our PACS system or those types of things. And so everything had to be done more manually. I mean, literally with physicians, and others going to the old imaging reading room and with the radiologist, a surgeon and radiologist and maybe even other clinical staff reading the x-ray and then going back and being able to take care of those patients. Certainly only emergent and urgent cases continued. Elective cases were put off, obviously, until we were back up and operational. But you think about blood banks, lab work, all in the enormous amount of paper that has to be generated so that when we do go back up, and this has been touched on by Shane and Gerry already, that our business continuity program, and people were looking right from day one. And so what are we going to do with this, with all of this paper? How are we going to ultimately get it back into the electronic health record and into our business billing systems so that, in fact, we would be able to have income coming in? Understand payroll, Kronos, all of those systems that we use for payroll were down. And so we had to come up with HR people with a methodology to continuing to pay our employees and track time and reconcile payments to employees that we continued to make after the fact. I recall one of our older physicians was thrilled that the electronic health record was down and loved it being on paper, but we discovered that our residents didn't know how to write prescriptions on paper because they never had to do that before. And so those were kinds of things that we had to manage as we did it. And of course, all along thinking, how are we ultimately going to comply with regulations? Where Gerry came in and really handled, our operators, our health information people, lab and others worked for literally months on reconciling and bringing back that information. By the way, handwriting became a big issue because we'd moved away from handwriting, and now we couldn't read patient names on a lab report or couldn't read the order properly. And so there had to be a whole process set up to reconcile when we couldn't understand the information. And I remember going in and there's dozens and dozens of people that are reconciling all of this handwritten information. In the end, how many records were exposed? And how are we going to manage the notifications? And that required, and Gerry can elaborate on this, literally outside companies going through a huge amount of data and information, reconciling duplicates and triplicates and all of those types of things, identifying the number. Well, people were frustrated calling us on a regular basis going, was my information exposed? I had doctors. They were getting little hacks at home that had nothing to do with this, assuming all of a sudden that it had to do with the ransomware attack, and therefore Scripps had to be responsible for that. And in the end, setting up outside call centers so that there were enough people to take the calls and internal staff to be able to handle the issues that were coming up that the call centers couldn't handle. And then ultimately the notifications, that whole process that took place. I mean, literally we're talking about 3.5 weeks, but we're talking about well in excess of a year to manage all of these pieces appropriately.
Thanks, Chris. Gerry, if you could further elaborate on all those recovery processes and those issues that you had to deal with.
You bet. The recovery, as Chris mentioned, has a very long tail. Addressing the privacy requirements alone was a significant, and I would say, as Chris noted, a Herculean effort. You have to look at all of the documents or any piece of information that may have been accessed by the threat actor and make sure that you properly notify the patients who are impacted. Now, again, one of the benefits for us at Scripps was that the threat actor never got into our electronic health record. They never got into Epic. However, most organizations put a significant amount of operational data, right, on their different storage areas around the company. So in our case, it was on our network servers. So those network servers had daily census. And so the type of information was pretty limited, right? It may have had a patient's name. It may have their physician's name. It may have had their location or their time for the procedure or the treatment, and that was it. But that alone gave rise to a notification requirement that we need to have under HIPAA, and any organization has. And again, as most of you are aware, if it's over 500, then you've got additional requirements and responsibilities that you need to attend to. This isn't just a single document with a single patient name. It could be a spreadsheet with hundreds of patients' names. And so you need to go through all of those and understand what is the required notification to each of those patients. How are we going to do that as timely as possible? We need to demonstrate, right, to ourselves, to the public, and to the regulators that we met the expectations that we have for the community that we serve each and every day. I was going to mention, as we went through the recovery, our focus was and always is, even when all of our systems are online, is to focus on supporting our patient care, supporting our physicians, our clinical teams, right, to do the work that they do each and every day. But as Chris mentioned, there's also the business of healthcare. And that business of healthcare is also making sure taking care of them means paying them. And so as Chris mentioned, when our systems were down and our internet connections and our network connections between systems were no longer working because Active Directory was impacted. So we're no longer able to communicate as easily internally. And those business systems didn't communicate with anyone. We needed to find alternative ways to deal with that. And so one of the pieces that I'd also just encourage people is to set up those different teams that are available to support that ingenuity that's happening on the fly to make sure that those legal considerations, the privacy considerations, compliance considerations, all of those other things are being addressed in real time so that we can deploy that. I think Shane talked about the importance of bringing back online those clinical systems that were prioritized that are required for delivering the patient care that we needed to. And so there were a lot of people that said, I want the payroll system up. Well, the payroll system was important in that we needed to pay our employees, and we did that. But we needed to prioritize other systems ahead of that once we were able to find a way to meet payroll. There are certain things, right, when you run a business that are not optional. One is for us delivering safe, high quality patient care, and the other one is paying those individuals that do that work. But it is a long tail, having to address the class action lawsuit, having to address your privacy requirements, both at a state and federal level, and making sure that you're doing those notifications takes an enormous amount of work. And as Chris said, I even maintained a log because there was no shortage of individuals that were convinced, whether it was our patients, our own employees, physicians that we work with, that somehow their information was caught up in this. I think, the world continues to evolve. I think every week or once a month, all of us get notified that our information was compromised somewhere. But again, you're always thinking of what's happening in the moment. So I maintained a log, and I made sure and scrubbed that log to see if there was any instance that was connected. Fortunately, we did not identify any connections to our event.
Thank you for that, Gerry. And Chris, thank you and your team for your leadership and courage to come forward and tell your story. I have no doubt you will help defend healthcare in America against these type of attacks. And I also want to thank, of course, all our frontline healthcare heroes for everything you do every day to care for our patients and serve your communities. On behalf of the American Hospital Association, this has been John Rigi, your national advisor for cybersecurity and risk. Stay safe, everyone.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.